Pathogenic agents can be present in the body for some time before any clinical manifestations are obvious. Now, this graph will illustrate the onset and possible course for most infections. On the y-axis we have the pathogenic load, or the number of microorganisms, and on the x we have the time taken. So firstly, what has to happen is a pathogen has to enter the body, which then continues to grow and replicate and form a colony. Now these two together form the first phase, which is the incubation phase. So this incubation phase can last from days to months and is the point of entry of the pathogen up to just before any signs and symptoms are obvious. Now if the pathogen continues to replicate and grow exponentially, okay, it will lead to the next phase, which is what we call the prodromal phase. Now this phase is not obvious in all infections, okay, but generally this is where the person will start to feel fatigued, lethargic, just feel like they are coming down with something. Okay, so this is not always present. Now if the pathogen continues to grow quickly, okay, exponentially, it will lead to the next phase, which is the acute phase. So the acute phase is where signs and symptoms are at their peak and they're most obvious. Okay, now depending on the virulence of the particular pathogen will determine where it goes from here, but also determining how the body reacts to it. It can resolve, or if the pathogen continues to replicate rapidly and grow, therefore we will lead to an overwhelming response. So the pathogen essentially will overwhelm the body, okay, and lead to the next phase, which is sepsicemia. Sepsicemia is the multiplication of the pathogen in the blood. So this could be a bacteremia, which is bacteria in the blood. It could be a viremia, which is a virus in the blood, or a toxemia, which is the endotoxin or the exotoxin from the bacteria. And this could ultimately lead to sepsis, which is life-threatening, and it's actually more the body's response to the pathology or the pathogen, which then can actually further damage tissue. And ultimately, if this is not resolved, it would lead to death. So this is a very clinically life-threatening point. Now if we go back down to the acute phase, okay, if the body overcomes the pathogen, so your immune system takes over, takes control and kills it off, or an antibiotic or antimicrobials on board, then the numbers start to drop back down. We go back down to a smaller load, and we can get to a total recovery here. So the body can totally get rid of the pathogen and recover completely. Now, if it doesn't completely subside and there's still some microorganisms on board, we could lead to just an infection, a chronic infection, such as hepatitis. The signs and symptoms aren't really there, but the body is still infected.